Okie dokie. So I'm live. Let's see. Okay. Hi. Okay. So we're gonna get started. It's my first live on YouTube. I've done lives on other platforms, but not on YouTube. So welcome. I'm a dermatologist in Boston, and I'm here if you have any questions about skincare, if you have any questions about your skin, you can put them in the chat, and I'll try to answer as many questions as I can. So what are the biggest issues that you have with your skin? So I can also just going through here and seeing how it works. Great. Can everyone hear me? Are you able to put questions in the chat? Somehow no question. Oh, here we go. Hi, Stephanie. How are you? You guys hear me okay? So feel free to put any questions you have about skincare. Oh, awesome. Hi, Super Graham. Welcome. Feel free to put any questions you have, anything about skin, anything about skincare that I can answer. Awesome. Thank you, Stephanie. Great. And also, I can just go over like any common things that come up a lot. I'm a dermatologist in Boston. I've been doing this for 12 years. And I enjoy doing posting on social media because I think it's been a really nice way to educate people about skin. I feel like it's something that we shouldn't just like have this information and keep to ourselves. So, it's I feel like it's almost a duty to share it, and happy to help in any way I can. I would say big things that come up a lot are anti-aging, um, skincare routines, like what basic skincare routine, and then how to deal with very specific skincare problems like hyperpigmentation, etc. Um, Great. So Stephanie says, I took your advice and turned to muesli. It's been working great. Downside is my neck is peeling like a snake. Yeah. It's interesting how the neck is super sensitive to skincare. It's really weird. You would think it would be the face, but actually the neck is the biggest issue. And I have that same problem. So even if I'll put on my face, put on my neck, it peels a lot. Um, that's expected for a lot of skincare. For muesli is a prescription, or an online prescription. And It can be really irritating, and with retinols, that's common. One thing is you could use less on your neck than you do on your face, and also just make sure you're moisturizing afterwards. That can lock in the moisture. Make sure whatever serums you're putting on your face that are moisturizing, you extend down your neck as well. Because again, I think we pay extra close attention to our face and less so in the neck. But for some reason, neck skin is also super sensitive. Um, it's the case not just for skincare, but also for getting procedures like lasers. It can be like really, really sensitive on the neck. So hopefully that helps. Supergram says, I wanted to start retinol. I think the adapalene gel isn't enough. I have sensitive skin. Where should I purchase this? So, adapalene is great only because it has two different effects. It has anti-aging effects and it has anti-acne effects as well. It kind of works more like tretinoin. If adapalene is not giving you the most that you want, it may be that you actually need a prescription strength retinoid. Because really the difference between the retinoids is how fast onset they have. So all the over-the-counter ones they're adapalene, they're retinol, OL as an ending, they're retinal, AL, and all of those work very well for anti-aging, with adapalene being specifically better for acne compared to the other two. If you want to get really fast anti-aging effects, then you're going to have to go prescription, with the beginner being like a tretinoin 0.025%, and then going up all the way to the strongest is something called Tazarac, 0.1%, and that is going to give you the fastest onset. So a lot of the downside is the faster onset for anti-aging, the more potential side effects, right? So retinol and retinal tend to be like a little bit better tolerated. They tend not to be, but as Stephanie mentioned, she uses muesli, which is prescription strength. I actually most of the time use a prescription strength retinoid myself, usually just tretinoin, old school tretinoin. There are some new ones on the market though, that are expensive. They usually don't get covered by insurance. And those, one of them is particularly good for sensitive skin. So when you say you want to start something that's like a little bit stronger, but you have really sensitive skin, that is called a Reslo or Raslo. And it, again, the biggest issue is just cost. These are newer on the market, so they're just still, just there's no generic of them, but you can talk to your doctor about these prescription. People really like them. Actually, I find a lot of dermatologists when I go on the forums, these new ones are the ones that they're using, interestingly, because they just don't cause the same sensitivity that like old school tretinoin does. um, and so again, like if the adapalene is not doing enough, I doubt moving to retinol or retinal is really gonna give you what you are looking for, because they tend to all kind of be a little bit slow onset. Now, if you can be patient, generally over the course of a year or two, you're going to see the same results as like a month or two of tretinoin. So that's the biggest issue. I think like retinoids are like almost purposely confusing. I think, like unless you really know, it's kind of confusing. Like, well, what's the difference between this one and this one? But really, a lot of it comes down to like where they act, what receptors they act on, um, and then how fast you're going to see results. But generally, the results are similar. Again, if you have like acne and anti-aging, adapalene is the best over the counter. In fact, it's the only over the counter that really retinoid that works for acne. Retinol and retinal don't have great acne effects. So. And then in terms for like brown spots, they all kind of have very similar effects. Again, with the prescription ones having the best. Yeah, you've been consistent, and it's been a while on adapalene. Yeah. So I mean, that's the thing. Is you might just need to talk to your doctor about a prescription one. The downside of the prescriptions, a lot of times they're not covered by insurance. But usually there's like either you can use like coupons at your pharmacy. You can usually get it down to around like 40 to $60 for a tube, and that tube will last you for like a few months. So not the cheapest, but not the most expensive. But sometimes you kind of have to like ask your pharmacist about it. It tends to just be, some people can get tretinoin and those prescriptions covered by insurance. It really depends on your insurance and it depends on what you're using it for. But for the most part, if you're using it for anti-aging, brown spots, then it's difficult. Um, and and then there are some online pharmacies that you can get it, but again, you go through a prescription. But Muesli is one of them. There's a few of them online that you can go through and get prescription retinoids that way. So excellent. And so while we're talking about retinoids, I'll sort of review like all the things one can get from using a retinoid. So I think like in general, most dermatologists and most people you see online, like when you have like shiny skin, right? Like it's mostly from retinoids. There's like some other skincare magic that can help, but that is primarily retinoids turn over your skin. They make it turn over faster, so you kind of push the old skin up and out. So they help with wrinkles because basically they kind of push the old dead skin out, but they also stimulate collagen production because as we get older, our skin cells say like, look, this is a lot of energy to maintain your bouncy beautiful skin, and I don't want to do this anymore. I've like done this for you for 20 years. I'm not going to do this. And so they kind of just stop. Like you don't get the repair and the increase in collagen that you got like when you're in your 20s. So in your 30s that starts to drop off, and it drops off like every single year. So you have to sometimes do things to like wake it up and be like, hey, I still like bouncy skin and smooth skin. And so retinoids are essentially probably the one of the best things you can do to for that reason. Um, they also help with brown spots because they can turn over the skin, with the caveat that they can be so irritating then that can, especially if you have darker skin that easily hyperpigments, sometimes they can be a little bit dangerous in that way, a little iffy. So you just have to be careful out in the sun. You have to be careful not to like overdo it because you don't want it can help with pigmentation to an extent unless you overdo it. Other things it can help with is it stimulates hair follicles. And when I say that it stimulates hair follicles, prescription retinoids like tretinoin and adapalene stimulate the hair follicle, whereas retinol does not. So it can be really helpful for like if you're getting milia under your eyes or on your skin, those are little follicular cysts, so that can help get rid of those milia. If you have hair loss, actually putting tretinoin on before you do anything else like minoxidil or anything else actually stimulates that hair follicle for the same reason. Um, Little bumps on your arms called keratosis pilaris, you can actually use retinoids for that as well. You can use tretinoin um, or adapalene that stimulates the hair follicle to try to turn over the hair follicle. So it's very useful, which is why you hear about it everywhere. Um, and then things that when you can't use it is pregnancy because it acts on the same receptors that are like in a developing embryo. In theory, we probably don't eat a lot of our skincare, but I think it's just sort of this fear of that if you it doesn't absorb very well in the skin, but if you like are taking it in, it's just like not worth the risk. So generally we say avoid it during pregnancy. It's kind of like use at your own risk during breastfeeding. So there's just no studies essentially. Um, and other things that it's very helpful for, again, going back to acne, is it since it turns over the pores, it turns over the hair follicle, it kind of tells your body not to produce as much oil. It's great for acne. I mean, it's the number one prescribed medicine for like your basic comedonal acne, meaning like bumps and maybe like a few little red spots. It often is not quite enough if you have like very bad cystic acne. But there's a reason. So basically, Accutane, which you hear about, is a retinoid. it's an oral retinoid though. You take it by mouth and it turns over those cells. Um, and so the it basically is just like a stronger. It's like in your body and it goes to everything. So what's the downside of retinoids? They are super drying, right? There's a reason they decrease oil production, so they are drying everywhere. Obviously, the stronger the retinoid you're using, the more dry you will be. And the more you'll notice peeling on your neck and peeling around your mouth and peeling around sometimes your eyes as well. Those are really common areas. You might just like feel really dry. And like again, when you're taking Accutane, people say like you're the most dry ever, right? So those are just common. Taking omega-3 fatty acids can help. Using a lot of moisturizer before and after using a topical can help as well. Can you please save this live? Yeah, I will try. I've never done a live on YouTube, so I'm hoping I know how to save it. Let's just say I've done them on other platforms, but hopefully it's pretty clear how to save it, and I'll post it. How do you get a killer beard? So minoxidil is the best thing. The same thing that you use on your hair, on your head. It will stimulate the follicles in the beard to also basically minoxidil was originally made to be an antihypertensive medicine of anything. It's not a very strong antihypertensive blood pressure medicine, so it never really caught on for that. But people found that when they took it, especially even at really low doses, um, it increased their hair. It made their hair grow, of all things. And so it works topically. It also works orally too. The downside of minoxidil, especially for women, is you can get um, if you're taking it orally, is you can get hair everywhere because it stimulates it everywhere. So not everyone wants that. So for a beard, one thing I find is if you microneedle once a week in that area, use minoxidil. You can even put that same retinoid, the tretinoin, on before. All those things are going to increase it. Now, other things that are not as cost effective are, Latisse, the same, or eyelash serums. Those actually will work in your beard area. Again, you can have to use a lot of it. So, but if you happen to have it around or you want to invest in eyelash serums, those actually will work in your beard area. So I find minoxidil is just a little bit cheaper. Topical finasteride also will. That is prescription. So you would have to talk to your doctor about it, but that can also help, as can oral finasteride, but it definitely has a little more side effects. JD says that they love the feeling of the dry skin because it feels clean. That's totally fine. Um, yeah, I think it does make your face feel squeaky clean. So as long as you don't mind it, that's fine. Um, and Supergram says that she liked the video on microneedling, bought one, but scared to try. I mean, the over the counter, the home ones are like pretty low risk, to be honest. I mean, they really, as long as it's 0.5 millimeter needles, which the one I use is Banish, and that has 0.5 millimeter needles, you're not going to get into too much trouble with it. It's a great way to like increase absorption of whatever you're using. Um, the ones that they use, the microneedles that they use in office are much deeper, and that's where some of the bigger risk comes from because you're just going deeper in the skin, so there's just like a higher risk of scarring. But I think if you're like hesitant to just do an area that's like really low risk, like do your hands, For me, like my hands are like definitely they're like, oh, you're 41, my hands are like the worst wrinkly part. So I think that's a good way to kind of tiptoe into it. Does topical tretinoin have the same side effects? Yeah, topical tretinoin has the same side effects as oral in terms of being very drying without any of the systemic side effects. So, like, there's no risk of like joint pain or hair loss or anything like that. That comes from it being systemic in Accutane, but it can be very drying, and then again can be very irritating. So that those I think are the biggest. I do get flaking around the eyebrows. Great. So Rana says, I have too much facial hair and I want your advice on what to use as a skincare and at the same time doesn't grow more hair on my face. Totally. Um, so um, I would say, most skincare is pretty safe, but Um, in terms of hair growth on the face, I would say like castor oil probably is like some people do describe that it can increase hair growth on the face. I'm not I think that's more anecdotal. But I think it's certainly possible. So castor oil is often used on the eyelashes and the scalp to increase hair growth. And the thought is that it actually castor oil has a little bit of like a prostaglandin analog effect, and that's how serums work. So it's like a mild prostaglandin analog. So in theory, it could stimulate the hair on your face. Um, Myo-inositol, which is a vitamin, has actually shown if you have like a lot of hair on your face because you have like PCOS or some other hormonal uh, change, that myo-inositol might decrease that. That's called hirsutism when you have like a lot of hair. Um, and that can, in some people, you could talk to your doctor about decreasing those effects, those side effects. Same with like if you're losing hair because of a hormonal syndrome like PCOS, same thing. It can kind of help with those. Um, do I dermablade? Yeah, I have. I kind of go back and forth on it. I have really sensitive skin, so I have occasionally done dermablading and then had it be irritating. Overall, I'm a fan of dermablading. I think it's a good way. Like for instance, for Rana, who if you were having issues with too much hair, I actually find dermablading can be a good way to control that. Um, and again, occasionally it can cause irritation, but for the most part, usually it's pretty safe. One big misconception about dermablading that I will mention is that dermablading does not make the hair grow back darker or thicker. So sometimes I think what happens is like over many years, if you've been in the sun, that hair has been come like blonder with time, and so you might cut it and think it's growing back thicker or darker, but really it's just that's like what your hair looks like, and it just hasn't been out in the sun for 20, 30 years. So definitely, dermablading is something to consider. I was thinking about dermablading. Is it like shaving? Yeah, I mean, it's like shaving. And honestly, you can just shave your face. If you're gonna do that, if you're just gonna shave, I mean, they make home dermablading devices. I actually find that those are like more intimidating. They look like a switchblade. um, but if you use like a gentle razor, like there's a few razors out there that are just for like pubic hair or for like very, underarms. Those safety razors are actually very safe for your face. You just want to go in the same direction as the hair, which is down. And that is also the case for any males who are shaving. Oftentimes people shave up, but that can actually increase the amount of like ingrown hairs you get. So you definitely want to shave down if you're just going to shave. I think it's totally fine. Obviously being aware that like some razor blades are going to be more irritating than others. Um, oh, thanks, Supergram. I love having you. Yeah. Um, and yeah, and it's fun doing these lives. I figured I'm gonna try to do them more often. Ideally, I'd like to do it once a week, but I happen to be off. I usually operate on Fridays and I'm not today. So I was like, I'm gonna get on and do a live. So I'm glad you're here. Are there any negatives to dermablading? I think just the ones that you mentioned that it can be irritating if you have sensitive skin. Now, I have very sensitive skin. Like, I have rosacea, like, everything irritates my rosacea, and I can tolerate it okay. I can like, again, aside from, like, 1 or 2 times, I think things to consider is, like, don't use your retinoid that night when you do it. Maybe, like, take a day or 2 off. Make sure you're not in the sun. Like, things that kinda trigger your sensitive skin, then don't do those things, but, I've actually found, like, dermablading, shaving, things like that really do help the look of your skin, especially sort of on the cheeks. Um, and so I think it's pretty safe. You always hear of like some issues, but Nair is an option. Yep, absolutely. Um, I think the biggest thing with Nair, if you've never used Nair, is it smells awful. But otherwise, it is, It's totally, it's safe. Again, I would say if you have really sensitive skin, I would do dermablading before I did Nair. Because Nair, I think, is more likely to be irritating than the dermablading. So, oh, anything to help weak fingernails that break easily. I have this problem too. Um, so I think the biggest vitamin deficiencies that are associated with weak fingernails are zinc. That's an underrated one. Um, Iron and protein. Those are like the big ones you want to make sure that you have in your diet. Obviously, you want a balanced diet in general. A collagen supplement has been shown to help hair and nails. A lot of the hair and nail vitamins that you see out there are mostly just collagen supplements with like a little bit of biotin and zinc and iron. Like they have kind of all of it together. So I do find I notice a big difference if I'm taking a hair and nail supplement versus not. Right now, I have not been taking one, mostly because I ran out and then I kind of like forgot. Um, Actually, I got one I like didn't like at all, and so I haven't been using it, but I haven't also replaced it. But you really will notice a big difference, because a lot of times we think we're getting enough protein or we think we're getting enough iron. Obviously, if you some people just genetically have breaking nails, weak fingernails, and then sometimes people also, they have thyroid, you have thyroid conditions, different things that make your nails more brittle. um, if you look a lot of times, just even in like CVS, Walgreens, they'll have nail strengthening layers, like nail polishes, and those do work. Actually, they like just add a layer of keratin, essentially, and so they can actually strengthen your nails. It's not long term; you have to continue to use it, but it can help. But I found zinc is actually one of the ones that helps me the most. It's just you have to be careful with zinc because it can cause awful nausea, and so it has to be balanced with other vitamins that you're taking. So you don't want to just take zinc, but if you take it in a hair supplement, it's usually good. Um, yeah, dermablading. Autumn Elaine says or exfoliate. Dermablading is exfoliation. Yeah, I mean besides hair, dermablading takes off the top layer of your skin. It's the dead layer of your skin though that it takes off. So that's basically what chemical exfoliation does as well. What can be recommended for sweaty hands in teenage daughter, 19? So basically like the treatment, like if you came in and saw me and you had sweaty hands, the first thing is aluminum chloride, prescription strength, aluminum chloride. That is essentially what like an antiperspirant is. Like when you buy an antiperspirant, it's some formulation of aluminum chloride. So that's the first thing. Now it's not going to work for everyone, and it's kind of like a little chalky. And then the next thing is glycopyrrolate, and that's a prescription. It's by mouth, and it reduces um, sort of the sweating response, mostly under the armpits, but also the head and also the hands. Those are like the big areas that you sweat from. Your feet too. So those are like that's the ladder. You would go from there to there, and then you would consider Botox injections actually, and insurance will usually cover it. It's a real big pain to get it covered, but it can be done. Um, but they'll usually make it that you failed one of these other things, and you numb your hands with like a numbing cream, and then there's like a bunch of shots like all around the palms. It lasts anywhere from 3 to 6 months, probably closer to three than six. So it's, you know, people tend to like it. It usually works well. Um, but it does involve like many visits, like every 3 months. Insurance can be annoying. And then there are like some other things. So there's something called iontophoresis, which basically kind of blocks the sweat channel. There's ones that you can get like from Amazon if you just Googled iontophoresis machines. And then there's like more permanent iontophoresis, which is like machines that you would use at your doctor's office that can like again more permanently um, get rid of sweating. So, it runs the gamut of what you can do, but that's usually the start. So if you haven't done aluminum chloride, that's like the beginning. They have some that's over the counter. It's not as good as the prescription strength, but like super low risk. Very low risk. You do not need to sweat out of your hands. Like I think there's a lot of like misinformation. Like you need to sweat. but that's not true. Actually, like some people don't have the gene to sweat under their arms or from their hands, um, or from their scalp or anything. You don't actually like biologically need, so they have like no body odor. Um, and so it's, some people have overactive sweating, right? So you don't, there's no danger to blocking those sweat glands. Um, and so I think seeing a doctor, either probably a dermatologist is the best, but your primary care doctor could at least like start you on that journey. Um, Golden Snake says, new here. Hope everyone here is well. Are you actually a doctor with a doctorate degree? I am actually a doctor with a doctorate degree. In fact, I think if you go to my YouTube, it'll say this is from a licensed MD or whatever, a licensed blah, blah, blah. But yes, I am a medical doctor. So meaning I have an MD from I went to Yale for med school. I went and did most of my training at Yale. And then I spent a year in Northwestern and a year in New York. And then I was from Boston originally. So I came back to Boston. And that is where I worked since I left fellowship 9 years ago. So, yes, I am. Best in office options for crow's feet in the 40s. Uh, Best in office is Botox for crow's feet. Um, the downside is it doesn't last that long. It lasts about 3 months. The other things that can be sort of more long term to resurface the skin is fractionated laser, and you can do a less aggressive form of laser, which is a non-ablative fractionated laser. That is with the brand names. There's a bunch of brand names, but one is called Fraxel, and you might need like 3 treatments. It can definitely help with sort of I actually personally have done it once, and I probably should do it again, honestly. But it, can help with the little lines down here. It can help with lines here, and can even like help with some of the crepey skin up here. Um, and you can use them in combination. You can do Botox and you can do the laser. There's fractionated CO2, which is ablative laser, which is a much more intense process. Usually you only get it once and expect to just be, have some downtime for a week to 4 weeks, depending. So let's say, so yeah, I would say those are the best in office procedures, but like Botox is the most common. Um, and probably expect to pay. Usually they'll kind of charge you based on the location or along the units. So here, like your usual units is maybe like 12 to 15 for each eye. So it's gonna like be several $100s depending on where you go. They do sell OTC body antiperspirants. Yep, they do. Um, Yeah, so they do have over the counter ones, which are great, that are, um, and then they have like a stronger, even stronger prescription one. Dry Sol is the name of the prescription. It worked for my child. Yay, great. That's good to hear. Dry Sol is and interestingly, Dry Sol we use as dermatologists all the time because it also stops bleeding. Like, so when we do biopsies, Dry Sol is what we use to stop bleeding in office. It's very, very helpful. Um, what do I practice? I'm a dermatologist. I primarily focus on skin cancer treatment, skin cancer prevention, but I'm board certified. I'm double board certified, both in Mohs surgery and dermatologic oncology, as well as dermatology. And I practice at Brigham and Women's. I very, very rarely have body odor. Figure is my Native American and my family gene pool. Yeah, there you go. So yeah, some people just have this genetic variation, ABCC11, where you just don't sweat that much. Amazing. And then the sweat is what basically causes the odor because it provides food for the bacteria on your body. And those bacteria are what cause the odor. We all have the bacteria, but they just like when they have like a swimming pool of sweat to live in. And so they don't like love when it's super dry, and they don't, we all have them all around, but when you sweat, that's how you get body odor. What's your opinion on chemical peels? Chemical peels are great. And honestly, I think they've kind of, been overshadowed by lasers, but they are cheaper. They're very effective. And like I think they kind of like went out of vogue for a while because when lasers were coming back, but now I feel like it's been sort of more balanced nowadays. So chemical peels are just like lasers, where there's like no like one chemical peel that fixes everything, right? They're a little more targeted to what your concern is. So they're great. So and it depends on how deep they go in the skin. Same with lasers. Lasers have different ways of going into the skin. They go to different depths, and same with chemical peels. And so really it's going to be a conversation between you and your doctor about like what you or your provider, whoever's doing the chemical peel, about what you are most concerned about, because each one is going to be slightly different based on and so there's like a wide variation from like TCA to glycolic acid peels to phenol peels. So you just really want to talk to them, but I think they're great. Castor oil has worked for me. That's great. Chemical peels are amazing depending on the strength. Lip lines for laser. So lip lines, um, so again, like chemical peels and lasers can work well, and microneedling can work well for lip lines. Usually, it's something that's going to go a little deeper to affect wrinkles. So that could be a fractionated, the same thing as like we talked about the eyes, like a fractionated non-ablative laser, like a Fraxel. Um, Fractionated ablative laser, which is like ablative fractionated CO2, that's going to be a little intense, but it will work, and it'll work pretty fast. So, I think it depends on how fast you're looking for a result. Now, you can do other things for lip lines as well. Um, Sometimes people will put a tiny bit of Botox. You can get like 4 units of Botox in the top lip, and that will actually partially help those lip lines, especially if they're not too defined. The problem is that like it can make it so you can't whistle well, or if you like play an instrument with your mouth, that might be affected. So those are things to consider. Some people even put like a little tiny bit of filler on the top of the lip, and that will lift those lip lines up. So there's like different options. Personally, I actually like the laser as the best option. And I actually will do, I have like natural like smoker's lines, even though I don't smoke. My mom has them too. And I will do fractionated non-ablative laser like once a year, and that has helped. Um, is there any information or studies upon using growth factors in skincare with people that have had skin cancer on the face? So, in terms of, I just want to make sure I understand this right. So, like growth factors increasing the risk of cancer, I assume, or growth factors decreasing the risk of skin cancer. I'm going to assume it means increasing the risk of skin cancer. So, no, there's not good studies, but I also don't think there's very much risk in terms of using topical growth factors for skin cancer. I think it's probably very minimally low risk. So I think it's safe to use. Um, I don't, and I can't imagine any reason why it would help skin cancer. I don't think it would at all. But I think you're safe to use them. Any advice for preventing pimples from appearing after shaving my upper lip? Yeah, so that's like a folliculitis. So again, maybe using like a razor that's like made for sensitive skin. Like they sell ones that are like for underarms or pubic hair, and make sure you're shaving in the direction of the hair. So all those things um, can help, like make sh- or you can use, if you're a man and you have like a lot of hair, then you can use an electric razor, and that will decrease. Those are basically like, it's called a pseudofolliculitis. So it's not a true infection of the hair follicle. It's just that the follicle gets blocked essentially by you shaving it. It's very, very common to happen. Um, do you think chemical peels are safe for skin on people with EDS? Interesting. So anytime if you have, so EDS is Ehlers-Danlos syndrome, and it is, I just realized I need my charger in here. Let me put my phone charger in. So Ehlers-Danlos syndrome, anytime you cut or get surgery, it can cause a really funny scar. You're more susceptible to getting these fish mouth scars and funny scars that are not always ideal. And so, I don't think there's any studies. I would have to look if there's actually studies on this. I the Sorry, I'm trying to plug my phone in at the same time. So it's not one of the things that we consider with chemical peels, but I would definitely, definitely, definitely bring it up to your doctor, because it might be one of those things that is where they would do something different depending on the depth of the peel. Okay, yeah, I got my charger in. Okay. Um, but definitely, especially if your RVM is surgery, like I'm a Mohs surgeon, I would definitely want to know if you have Ehlers-Danlos syndrome because it would affect how I thought about your closure. Um, just give and like how your ability to heal because even like simple closures won't heal so well if you're Ehlers-Danlos. I've had acne-like lesions on my arms and left kind of raised bumps, and it's been there for a while now. It's Is it just about exfoliation to reduce the bump size? So it depends a little bit. It's hard to say without seeing. Um, so if it's a, a scar, like a keloid scar, or if it is something called a dermatofibroma, then exfoliation is not really going to help. Sometimes an injected steroid can help. Even if you massage it, it can help. And if you put silicone gel sheeting, it can help flatten it. Um, but it's based on how you describe it. My guess is not uh, that exfoliation alone is not going to remove it. But again, I can't see it, so I'm not sure exactly. Keratosis pilaris, which are the little tiny bumps on your outer arms in general, those can be improved by exfoliation. So if you use glycolic acid or lactic acid or salicylic acid, all of those things, turning the skin over, or even just using like a physical exfoliator on the outside of the arms, that can definitely help. But from what you describe, it sounds more like a scar or dermatofibroma, which Stephanie says she has to run. I will try to keep going live. Thank you. I'm going to try to make like a weekly thing. It's always been my goal, but I haven't made it. Great. Will you talk about Reef Safe sunscreen and what do you look for? Yeah, so Reef Safe sunscreen has no chemical sunscreens that are hormone mimickers. And so hormone mimickers are most of the chemical sunscreens out there. And what that means is just like it acts like estrogen. So when in the environment, it looks similar to estrogen, it can kind of bind estrogen receptors. So the reason it's thought to be not reef safe is that these corals are very sensitive to these hormone mimickers. Again, I think it's probably not the whole story for the uh, for these reefs, but that's why these laws have been passed in Hawaii and in Florida, eliminating chemical sunscreens. So you can find sunscreen. It's not all chemical sunscreens; it's banned, but all of them have some little bit of hormone mimicking abilities, with a few being the big guys, which are like avobenzone. Um, and so, if you can just buy sunscreen, it will say it's reef safe. Like it will say it right out on the outside of the bottle, reef safe. If you want to really just completely like not even have to think about it, then a mineral sunscreen is probably the best way to go. Mineral sunscreens are either zinc oxide, titanium dioxide, or both of them together. Zinc oxide has great UVA, UVB protection, broad spectrum. It works really well. Sometimes it makes you kind of white and pasty. Not great for skin of color, but has really it's completely reef safe. So, again, most of the states where it's banned, you're gonna it's probably they're probably only going to be selling reef safe sunscreen. And then if not, it will say it right on the outside of the bottle. Oh, thank you. Autumn Elaine says I'm absolutely gorgeous. That is like the best thing I've heard all day. Um, Golden Stinky said that they're not new here, that they're subscribed. Hooray! Um, I use frankincense, myrrh, and eggplant extract for skin cancer on my nose. It worked for me on my husband's forehead. Oh my goodness. Um, yeah, I don't know. I feel like I see a lot. I think like the downside I think for most skin cancers, like a lot of these topical things probably like could work. I think the problem is like I work at a tertiary hospital. Like I work at the place where like everybody gets sent when like all the really bad things happen, right? So I definitely have a selection bias, but I have seen so many bad cases of people self-treating at home with like different like I had a patient who had a, mel- a skin cancer right here, and they treated with black solve at home, and it kind of went away for like a little bit for like a few years, and then it like came back, and he came in and it was this like awful melanoma, just this like giant deep stage 4 melanoma that he had been just treating with this black solve, and it was just like one of these cases that just like went so poorly. He ended up having to get like this awful surgery, like neck dissection. This is a number of years ago. I don't even know if he's still living actually. So I think like by default, I see all these like awful, scary stories that like make me very nervous when people do home remedies. That being said, like probably, with these early skin cancers, we use topicals for early skin cancers like 5-fluorouracil or things that are trigger your immune system for these early ones. And I can do a video on that too. I've actually been thinking about doing it, like non-surgical treatments for skin cancer. But, I think that there are those cases, but I definitely wouldn't recommend it. Of course, like I am totally biased because I cut skin cancers out, right? I use gentle AHA 2 days after dermablading. It helps my follicles. Excellent. I think that's great advice. I think like doing like a gentle AHA exfoliation. Um, I've heard derbs describe skin cancer as pimple-like bump that won't heal. I'm in Arizona. It's very prevalent here, so we're very careful here. Excellent. Yeah. I think most skin cancer does so most of the most common skin cancers present as like a little pink bump a pimple that won't heal. And that's why I tell people, I'm like, if you have a pimple and it's maybe coming and going, but it's not gone after 8 weeks, 2 months, it's not a pimple, right? It should be checked out. And that doesn't mean it's definitely skin cancer, but it's not a pimple. If it's in the same place and it just like keeps going, maybe it's bleeding, sometimes it's not. Um, it definitely should be checked out. I think the problem is also skin cancers can present other ways. A big one is like a scabby lesion that's not going away. Melanomas can be a changing lesion, like anything that's new or it was round and now it's shaped like Florida. It's dark and now it's white, or it's white and now it's dark. Anything that's like changing over 8 weeks should be brought to your doctor's attention. Again, not because it's definitely skin cancer, but because it should at least be checked out. There are plenty of benign things that also act that way, but we just, I agree. If you're in Arizona, you're getting a lot of sun, you got a lot of sun when you're a kid, probably err on the side of caution, have it looked at. Um, let's see. That's why L-ascorbic acid should not be used daily, but once a week. Is this correct information? So no, you can use L-ascorbic acid daily. Um, unless you have very sensitive skin, L-ascorbic acid can be used every single day. L-ascorbic acid is vitamin C. So totally safe to use every day unless you have very sensitive skin. I think AHAs and BHAs, mild exfoliating acids, those usually can't be used every single day. I've made that mistake trying to test the theory that it can't be used, and you get like super red and red on or I get super red. I don't know, on my neck, on my face. So you don't want to take off more than the top. But the L-ascorbic acid is not much in the way of exfoliating. You can use it every single day. Oh yay, Patricia Beach, my first live. Glad to have caught you. Yeah, this is my first live on YouTube. Again, I've done it like on TikTok, I've done it on Instagram, I've done it on Facebook before. But I really want to get on here on YouTube and try it out. So I'm hoping to do it consistently. Somehow I feel like the day always like gets by me and I'm like, oh, I didn't do it again. Plus I have two small children. So like whenever I'm home, like all my friends who don't have children and do this, they like do it like, at night or da da da. And I'm like, it takes me like hours to get the children down. So, it's like most of the time I'm posting like while I'm putting them down to bed. Like they're in bed and I'm like they're posting on the ground like this. So just it's it's probably what keeps me from doing lives. But um Oh, good. So Autumn Elaine says, yes, do a video on non-surgical skin cancer treatments. Great. Yeah. I actually have like it all prepped and everything because I'm giving a talk on our big national meeting in March on this because actually like even for dermatologists, this is kind of a new, not a new concept, but it's like a little bit of a controversial concept, treating skin cancers with non-surgery. And obviously, I'm a surgeon. I like cutting stuff out, but like if it were on my face, I would want to at least discuss some other options, right? So, when they're very superficial skin cancers, like oftentimes we have like pretty good data suggesting you can use certain topicals. They are prescription topicals, mind you, but they're like pretty safe, pretty well tolerated, and it's what I would want, if it were on my nose, right? So, I think it's interesting because it's like it's even like when I present at our Academy of Dermatology meetings, like a lot of people show up to like hear about this topic because it's not something that like everyone discusses. And a little bit of it's because you don't get paid a lot to use topicals and you get paid more to cut things out. So there is like a perverse uh incentive to cut skin cancers out. Now, granted, like a lot of them really need to be cut out. Like, you know, I wouldn't be doing what I'm doing if I didn't think most skin cancers need to be cut out, but that doesn't mean all skin cancers need to come out. So, let's see. So I will hopefully do that next week or the week after. Can statins or trazodone cause hair loss? Can statins or trazodone? Ooh, trazodone, I don't know. So any new medication has the possibility of causing hair loss. And it's always hard to know because it can be the medication, but it can just be whatever the illness is that you're treating, and it can just be the stress you're going through. It's usually most of the time a type of hair loss called telogen effluvium, which is a temporary hair loss where your hair, all the hairs that are in telogen phase. We can talk about hair loss a whole different time. I have to jump off at 3 p.m. But um, your hair goes through a phase, it falls out, and then 4 months later, it'll grow back in once that stressor or medicine or whatnot has been removed. So yes, those medications could cause hair loss. So if you have telogen effluvium and you are not sure, then it may be worth talking to your doctor about it, especially if there's no other things like you didn't go through surgery, you didn't just give birth, you didn't, um, have some like really intense emotional stress. Then it could be the medicine. And usually the telogen effluvium, once you remove the medicine, it will reverse, but be patient. Not going to be immediate. It's going to be, um, sorry, I lost you for a second. I have another phone. Hopefully you can hear me. So it won't be immediate. It'll be like 4 months or so that it'll come back. I do wear a lot of hats. How do you balance melasma and rosacea treatments simultaneously? So azelaic acid can work well for both, both prescription and the over-the-counter one. It helps with the response of melasma and the redness of rosacea. So I would say that's the best one. Hydroquinone is the prescription that helps melasma the fastest, but it can trigger a little bit of rosacea. They sell prescription hydroquinone with a little steroid in it. That, again, you cannot use that for more than a few months at a time because that has its own side effects. Hydroquinone has its own side effects, but it can help kind of reduce the inflammation that you would get. So you tend not to get rosacea flares when you use that, but just know that it's not like a long-term solution. Triluma is what it's called when it's like all bashed together with a, and then actually both of them are sun sensitive. So using a mineral sunscreen with that's tinted can help both because it blocks some of the visible light as well. So if you do a tinted mineral sunscreen, and just like you have to be like neurotic about the sun. Usually sunscreen's not enough, to be honest. Like you have to be like wear a hat this big. I have a hat this big. Like when I go to the beach. I mean, it's just, and I wear a baseball hat everywhere, right? So both melasma and rosacea, you're just like beyond sensitive to the skin, like almost just like a vampire. And so you just have to be like aware, like a hat has to be in your bag. The wider brim, the better. Scalp treatment that doesn't feel oily or greasy, but helps with the burning hot scalp feeling.
Dry skin type and no flakes for my teen. Doesn't feel oily or greasy. Helps with a burning hot scalp feeling. So it's just the burning that they have. They don't have dry skin or flakes. They just have burning. That's a really good question. I think that it sounds like it's probably still kind of in the category of dandruff, but different things can cause like a burning scalp sensation. And some of them can be from meds, some of them can be kind of just like from like other pain syndromes. So it's hard to answer this question entirely without knowing. But probably doing doesn't feel oily, greasy. Even just using like a basic, like trying like a basic antifungal shampoo like Head and Shoulders or Selsun Blue or something along those lines, and just seeing, because then you would at least know if it was just dandruff. If it's not and that's not helping, it may be worth talking to the dermatologist about it just to make sure you're going down the right track with the diagnosis. Because again, painful scalp is not like a specific diagnosis. It's kind of more like a symptom of different things. So, is that what I say? Thank you for being generous and sharing your knowledge and helping educate us. Of course. I was unfortunate I got white spots on my face after a chemical peeling session, and a dermatologist told me it was vitiligo. Interesting. Yeah. Could be post-inflammatory hypopigmentation. If you already had vitiligo, then that might be possible. It's not common for chemical peels to trigger vitiligo alone. Usually it's more hypopigmentation, but that's unfortunate. Hopefully it will fade with time. Hypopigmentation, post-inflammatory hypopigmentation will usually fade with time. Azelaic acid can help kind of blend the color a little bit. And then again, counterintuitively, you also want to stay out of the sun because you don't want to darken the rest of your skin. If it really is vitiligo, then it won't even like pigment when you get sun. So I all of a sudden got a lot of brown spots. That can happen as you get older. Also, if you just recently got sun, azelaic acid, retinols are great for hyperpigmentation. Tranexamic acid, kojic acid, those are all great. And then there are some prescription medicines also, like hydroquinone. Great. How long can I use quinone? I assume hydroquinone is the question. Usually 3 months is the max at a time. Sometimes they'll do like 3 months and then 3 months off and then 3 months on, depending. It is a prescription, so your doctor will kind of walk you through that. But it has this weird side effect. Besides causing irritation, it has this weird possible side effect called paradoxical hyperpigmentation. And that means instead of hypopigmenting the brown spots, it actually makes everything much worse. Very rare, usually occurs with long-term use. So people who have been using it for years without taking breaks. And so that is sort of where this fear of using it for long-term comes from, because it's one of these like things where if it happens, it's very hard or impossible to fix. So, great, awesome. Thank you so much. I'm going to jump off. I am going to try to save this. Hopefully I can. But thank you for everyone for joining. I appreciate it. Take care. Okay.